All right, Melissa, thanks so much for doing this. My first question that I have for you is, tell the audience just a little bit about yourself and how you started in the community.
Okay. Well, thank you so much for reaching out to me. I am very excited to be a part of this, and I am really excited. So thank you. So like you said, my name is Melissa House. I am an LCSW supervisee. So I am working on getting all my clinical hours before I am a fully licensed LCSW. I got started in this work basically from my life experience. I have three boys, two of which have Down syndrome, and my oldest has Down syndrome, diagnosed with ADHD, and is on the autism spectrum. So over the past 17 years, I have really learned deeply what it means to be a family member and caregiver of someone with a disability and kind of, understand not firsthand, obviously, but what people with disabilities in this world go through in a world that's not quite set up for them. So with that, I've learned to navigate the very complex system or systems that are needed for people like my kids, along with learn how to advocate for them, and just basically how to show up consistently and very creatively in order to get a lot of their needs met. Um, so early on, I realized that a lot of things that families like mine needed don't exist. I find myself in a very fortunate position where I could intern and eventually work for the Arc of Northern Virginia, which I don't know if you're familiar at all, but is a really great organization for people with the disabilities in the Northern Virginia area. I became a caseworker and was able to help families get connected to disability related services such as employment services or helping them, navigate the social aspects of being able to find and maintain relationships outside of their family members and caregivers. Also helping them become independent or live independent with supports. So what I found consistently in that was the lack of psychotherapy for people with intellectual and developmental disabilities. A lot of times with the clients that I have now, I've heard that they've tried therapy in the past, and a lot of times I've been told that they're not a good fit or this isn't going to work out with us, and kind of like they're broken up with in therapy. So finding accessible and meaningful, impactful therapy has been very difficult with people in this community. So I decided I'm going to open my own practice and provide therapy for people with IDD, their family members, caregivers, siblings, any of that, as long as you fall in that category. And so I did that in February. And I started taking clients at the very end of February, and it's been a very steep learning curve, but I've absolutely loved it.
Mm.
So,
hmm So, you just said a minute ago that you opened up private practice and that you work with folks with IDD, family members and their care and caregivers, loved ones. So I'm wondering, what are the sessions like? What they walk into the room, and then the first thing that happens in the session, what's going on?
depending on what they want to do, what they want to work on, what they feel like they want to share with me. So like I said, I started just in February. And so a lot of my sessions with my clients have been a lot of rapport building still. That is the very most important aspect of the therapeutic relationship is the rapport building. And it's some clients, it's going to take a lot longer than others. But the most of the modalities that I have been able to use, cognitive behavior therapy, I've used dialectical behavioral therapy, um, I'm using motivational interviewing. And then most recently, I actually am really excited about this, signed up to get credentialed in sand tray therapy. I think it's going to be very helpful for a lot of the clients that struggle with verbal communication. So that starts in July, and I'm really excited.
hmm Tell me a little bit about that type of therapy, sand tray therapy. I've never heard about it.
Yeah. So it was, I think, originally started for working with kids that have gone through some sort of trauma, but it has been shown to be highly successful with teenagers and adults as well. And it's basically a, a tray with sand, and there's all kinds of little miniature figurines. It could be anywhere from like people, animals, imaginary kind of like dreamlike figures like dragons. There's fences. You can have just almost anything that you can think of. And they are able to create this world, whether it be directive or non-directive, meaning like I would ask them, hey, why don't you create what does home feel like to you? Or just let them create whatever they want to create. And then basically taking that and kind of gently working with them on why they did what they did or what they're feeling, how they're seeing. And it's a really different way for people who have trauma or, as I mentioned before, people with IDD that have challenges communicating verbally. It's a really good mode for them to be able to use to express their thoughts or their feelings or their experiences.
Hmm. And how is it different from other modalities like cognitive behavioral therapy, um, and others?
So with Santre therapy, it's more expressive. They're able to, it's not kind of like structured. I feel like CBT and DBT, all these other BTs, are very scripted and you kind of follow a format. With Santre therapy, it is what it is. You ask them to create or let them create whatever they are feeling and whatever comes of that, if they want to talk about it. We discuss it in a very non-directive, formatted way, if that makes sense.
Hmm. Do you know who came up with the with sand tray therapy?
I actually do not. I do not.
Hmm. Yeah, because it's again, it's so new to me. Um, my next question is, what have you learned in doing this kind of work with and IDD people with IDD and their family members? Like what have you learned? What do you sort of take away from, the one-on-ones?
Being extremely flexible. And I have a lot of learning to do when it comes to adapting the way we are taught in school to do things. So kind of sometimes throwing everything you learned out the window and figuring it out on your own. I found that I have leaned heavily on what I've learned from my own two kids with IDD in terms of just being extremely patient with listening and I know a lot of therapists choose not to work with this population because they're scared of not being able to understand, scared of what behaviors are might come with it. So with that, I have kind of a leg up on, I have my oldest child has a lot of issues communicating verbally. However, he sees himself as a verbal communicator, so refuses to use any of his speech devices. So, um, being patient and being patient with myself. And that knowing just to ask follow-up questions, kind of like, I'm sorry I didn't get that. Can you repeat that sort of thing? I think it's been the hardest so far in this journey.
Hmm. And I always ask therapists this, like what do you still hope to learn in terms of like something new as a mental health professional?
My wish in learning something new is trying to find a great way to adapt and make these modalities more flexible for people with intellectual and developmental disabilities. In all my research and my learning and going through school, I have not been able to find, and I don't think it exists, a modality that is created for this population. Everything has to be adapted in a way that you can figure it out. And doing all my research papers, it was always, well, there's not really anything specific, but these modalities can be maybe edited or adjusted best. So I think just honing in and finding more specific ways to work with this population would be my dream, if
Mm-hmm.
that makes sense.
And another question that's been on my mind is, I talked to this mental health therapist, and she said that, oftentimes, what drives someone to do something, especially in the mental health field, is, they have a mentor. They have someone that really knows, that has been there before, that knows a lot about the mental health field. So what I'm wondering for you is, who has been that mentor for you that said, hey, you should consider doing this, entering the mental health field?
So that's what's been a little bit difficult about working with this population in that there are very few, if any, in my area at all. So being able to ask those questions and rely on past experiences of people that have been there before me don't really exist. Um, I found that I wanted to be in the mental health field just through experience of seeing how lacking it is for people that I work with in support and case management. So that's kind of what drove me to want to do this. That on top of, wanting to be able to pave the way for therapy for one day if my kids should need or want therapy. My clinical supervisor is very supportive and very lovely. She works with people, mostly adults on the spectrum. And so we working together are learning new things every day. But she does not have the experience of working with people with intellectual disabilities. So we're kind of like teaching each other what we all know.
Oh, that's nice.
Yeah.
To kind of wrap this up, what advice, tips would you give to people who are wanting to learn about working with folks with IDD, or like pe their family members, caregivers, that kind of thing? What advice would you give?
Think making sure to have all the empathy in the world because families in this situation are going through so much that people don't know or don't understand. It could be anything from raising a child with an intellectual and developmental disability that also has significant health issues or significant behavioral issues and seeing different specialists yearly and navigating the Medicaid maze and the Medicaid waiver maze and all this complex systems that there are to try to learn and keep track of and know is very time consuming. And so just knowing that going in and talking with families, or if you have a family that comes in, they're stressed out and short-tempered and just frazzled and at their end, just patience and empathy because it's not you. It's the cards that they were dealt and the day that they were having that day. Um, yeah, and that's why we're here, hopefully, for the support, to support them and help them be able to find and navigate what they need.
Mm-hmm. All righty.